March is National Colorectal Cancer Month, bringing awareness to the second leading cause of cancer-related deaths in the United States. There's a new study on how your diet can impact your risk of colon cancer. We'll get to that, but first we're joined by Dr. Stephen Rauh. He's a colorectal specialist at Rochester Regional Health. Great to have you in studio, Doctor.
Good morning, Norma.
This study looks at our diets and saying that if the study says that, whether what we eat can impact our risk of colorectal cancer, we're hearing that, if you eat the fruits and vegetables and the leafy greens and those kinds of things that, they're low inflammation diets, that it can lower your risk. But you're saying, be careful what you read, and we all need to have the testing.
Excuse me. The study is intriguing, but it is still a little early to say that's well confirmed, and it could be misleading that if people ate those foods, the low inflammation type of foods, which basically are just good foods for all sorts of things, heart, weight, everything, people might think that they're preventing colon cancer, and unfortunately that's just not true. The real way to prevent colon cancer is to be screened.
Mm-hmm. Now, the guidelines are for people who don't know, people who have not yet gotten their first exam. When should people be getting them? When's the first time they should be going?
I'm going to give you the guidelines now, and I'm going to speculate on what's going to happen. Okay. The guidelines now are that for most adults without high risks, like a young parent that had colon cancer, start at 50. Okay. African Americans, often we recommend starting at 45, just because of the knowledge of the younger base in African Americans getting colorectal polyps and cancer.
There's a genetic, perhaps.
It's something that, correct. Okay. Lastly, there's been multiple recent studies in the last year or two with the trend towards younger adults affected with colon cancer.
Right,
Very
in general.
Concerning.
Okay.
And I think that the screening should be moved sooner, younger, and I think it will be somewhere in the next few years that we're going to get some guidelines. The thing about guidelines is what's behind who pays.
Exactly.
And that's what a guideline is almost more than anything else, because if people can't get covered, then it makes it nearly impossible to get the test. Yeah.
I know for some people, getting this screening is a rite of passage for them. They say, well, I've been screened, and, they may maybe be a little lighthearted about it. But the point is, though, that it's not something to fear, right?
Correct.
That the screening itself is not something, it doesn't, the people say, oh, does it hurt? Is there pain? I don't want to, subject myself to that. But you're saying it's not something to fear.
There are multiple ways to get screened, but perhaps the best way is colonoscopy.
Okay.
Because if during the exam a polyp is found, and that's a precancerous growth, then that polyp can be removed, and that person may be prevented from ever getting colon cancer, not even just catching it early, but prevented. So you may remember Don Alhart having his colonoscopy, and then he came to work that night.
Yeah, there was a campaign going on, yeah. That was great, and Don was like, came back to work that very same day.
It's just when you have your colonoscopy and you get taken care of and colon cancer gets prevented, it's a good feeling. 1 in 17 people will get colon cancer. So if just 20 people go and get checked from this segment, we'll save a life.
One polyp, if someone sees a polyp, they shouldn't jump to conclusions there, right, necessarily?
Most polyps are benign.
Okay.
Most polyps will not become cancer, but all cancers come from a polyp. Okay. So we need to get those out.
Get them out, get them tested to see if they are cancerous or not.
Exactly.
And like you said, once you know, that knowledge is power, and it's also a big relief, isn't it?
It's a good feeling.
Yeah, good. Well, listen, great to talk to you, Doctor. We really appreciate
see you, Norma.
it. Make sure you schedule your screening, folks. No excuses, right?
Correct.
Yeah. All right. Hey, weather, traffic.